The human spine, also known as the vertebral column, is a complex and important structure that provides support, flexibility, and protection to the body. It is made up of several key components. Vertebrae. These are 33 irregularly shaped bones stacked on top of each other, forming the main structure of the spine. The vertebrae are categorized into 5 regions. Cervical vertebrae, C1, C7, the 7 vertebrae in the neck, which allow for the greatest range of motion in the spine. Thoracic vertebrae, T1, T12, the 12 vertebrae in the upper back, which connect to the ribs and sternum, breastbone, to form the rib cage. Lumbar vertebrae, L1, L5, the 5 vertebrae in the lower back, which provide support for most of the body's weight and allow for bending and twisting. Sacrum, the 5 fused vertebrae in the low back that connect the spine to the pelvis. Coccyx, tailbone, the 4 fused vertebrae at the very bottom of the spine. Intervertebral discs. These are flat, round cushions made of tough, flexible tissue that sit between the vertebrae. They act as shock absorbers, distributing pressure evenly along the spine and preventing the bones from rubbing against each other. Spinal cord. This is a long, thin bundle of nerves that runs through the spinal canal, a hollow passage formed by the center of the vertebrae. The spinal cord carries messages between the brain and the rest of the body. Spinal nerves. These are nerves that branch out from the spinal cord and travel to different parts of the body. They control muscle movement and transmit sensory information like touch, pain, and temperature. Ligaments. These are tough bands of tissue that connect the vertebrae to each other and provide stability to the spine. Muscles. The back muscles are responsible for supporting the spine and allowing for movement. The spine is one of the most complex structures in the body. It is a structure that includes bones, muscles, ligaments, nerves, and blood vessels, as well as diarthrodile joints. In addition, the structures that make up the spine include the intervertebral discs, the nerve roots and dorsal root ganglia, the spinal cord, and the dura mater with its spaces filled with cerebrospinal fluid. Each of these structures has unique responses to trauma, aging, and activity. The bony vertebrae. Each of the bony elements of the back consist of a heavy kidney-shaped bony structure known as the vertebral body, a horseshoe-shaped vertebral arch made up of a lamina, pedicles, and 7 protruding processes. The pedicle attaches to the superior half of the vertebral body and extends backwards to the articular pillar. The articular pillar extends rostrally and caudally to form the superior and inferior facet joints. The transverse processes extend laterally from the posterior aspect of the articular pillar, where it connects to a flat, broad, bony lamina. The laminae extend posteriorly from the left and right articular pillars and join to form the spinous process. 2 adjacent vertebrae connect with each other by means of the facet joints on either side. This leaves a space between the bodies of the vertebrae which is filled with the intervertebral disc. The intervertebral foramen for the exiting nerve root is formed by the space between the adjacent pedicles, facet joints, and the vertebral body and disc. 2 adjacent vertebrae connect with each other by means of the facet joints on either side. This leaves a space between the bodies of the vertebrae which is filled with the intervertebral disc. The intervertebral foramen for the exiting nerve root is formed by the space between the adjacent pedicles, facet joints, and the vertebral body and disc. The intervertebral disc. The intervertebral disc is made up of an outer annulus fibrosus and a central nucleus pulposus. It is attached to the vertebral bodies above and below the disc by the superior and inferior end plates. The nucleus pulposus is a gel-like substance made up of a meshwork of collagen fibrils suspended in a mucopolysaccharide base. It has a high water content in young individuals which gradually diminishes with degenerative changes and with the natural aging process. The annulus fibrosus is made up of a series of concentric fibrocartilaginous lamellae, which run at an oblique angle of about 30 degrees orientation to the plane of the disc. The fibers of adjacent lamellae have similar arrangements but run in opposite directions. The fibers of the outer annulus lamella attach to the vertebral body and mingle with the periosteal fibers. The fibrocartilaginous end plates are made up of hyaline cartilage and attached to the subchondral bone plate of the vertebral bodies. There are multiple small vascular perforations in the end plate, which allow nutrition to pass to the disc. The intervertebral disc is not seen on standard X-ray, but can be visualized by means of MRI scan and CT scan. The integrity of the inner aspects of the disc is best visualized by injecting a radio-opaque agent into the disc. This material disperses within the nucleus and can be visualized radiologically as a discogram. The posterior facets. The facet joints connect the superior facet of a vertebra to the inferior facet of the adjacent vertebra on each side, and are typical synovial joints. The articular surfaces are made of hyaline cartilage, which is thicker in the center of the facet and thinner at the edges. A circumferential fibrous capsule, which is continuous with the ligamentum flavum ventrally, joins the two facet surfaces. Fibroadipose vascular tissue extends into the joint space from the capsule, particularly at the proximal and distal poles. This tissue has been referred to as a meniscoid, which can become entrapped between the facets. The posterior facets can be seen on X-ray, but only to a limited extent. Degenerative changes and hypertrophy of the facets can be visualized to a greater extent on CT and MRI. Radio-opaque dye can also be injected into the joint and the distribution of the dye measured. This section illustrates the central nucleus pulposus and outer annulus of the disc. The posterior facets are visible. The central canal is smaller than usual for this vertebral level. Courtesy, Churchill-Livingston, Saunders Press. The spinal ligaments and muscles. The vertebrae are connected by a series of longitudinally oriented ligaments. The most important ligament from a clinical perspective is the posterior longitudinal ligament, which connects to the vertebral bodies and posterior aspect of the vertebral disc and forms the anterior wall of the spinal canal. The ligamentum flavum, which has a higher elastin content, attaches between the lamina of the vertebra and extends into the anterior capsule of the zygapophyseal joints. It attaches to the pedicles above and below, forming the posterior wall of the vertebral canal and part of the roof of the lateral foramina, through which the nerve roots pass. There are also dense fibrous ligaments connecting the spinous processes and the transverse processes, as well as a number of ligaments attaching the lower lumbar vertebrae to the sacrum and pelvis. The musculature of the spine is similar in microscopic structures to that of other skeletal muscles. The individual muscle cells have small peripherally located nuclei and are filled with the contractile proteins, actin and myosin. The actin and myosin form cross striations, which are easily visualized on light microscopy of longitudinal sections of muscle. The sarcomeres formed by the actin and myosin fibrils are separated by Z-lines, to which the actin is attached, and are visible on electron microscopy. The nuclei of the muscle cells are thin, elongated, and arranged along the periphery of the cells. The spinal canal contains and protects the spinal cord and the spinal nerves. The spinal cord projects distally through the spinal canal from the brain to taper out at the lower first or upper second lumbar vertebral level. The lower level of the spinal cord is known as the conus medullaris, from which nerve roots descend through the spinal canal to their respective exit points.